Arthritis is a common condition that causes pain and inflammation in a joint. Arthritis affects people of all ages, including children. Osteoarthritis and rheumatoid arthritis are the two most common types of arthritis. Osteoarthritis is the most common type of arthritis. It most often develops in people in their mid-40s or older. It's also more common in women and people with a family history of the condition. But it can occur at any age as a result of an injury or be associated with other joint-related conditions, such as gout or rheumatoid arthritis. Osteoarthritis initially affects the smooth cartilage lining of the joint. This makes movement more difficult than usual, leading to pain and stiffness. Once the cartilage lining starts to roughen and thin out, the tendons and ligaments have to work harder. This can cause swelling and the formation of bony spurs called osteophytes. Severe loss of cartilage can lead to bone rubbing on bone, altering the shape of the joint and forcing the bones out of their normal position. In rheumatoid arthritis, the body's immune system targets affected joints, which leads to pain and swelling. The outer covering, synovium, of the joint is the first place affected. This can then spread across the joint, leading to further swelling and a change in the joint's shape. This may cause the bone and cartilage to break down. People with rheumatoid arthritis can also develop problems with other tissues and organs in their body. There are lots of different types of arthritis. The symptoms you experience will vary depending on the type you have. This is why it's important to have an accurate diagnosis. There are more than 100 unique conditions classified as arthritis, each with different symptoms. In general, the first sign of arthritis is pain, also called arthralgia. This can feel like a dull ache or a burning sensation. Often, pain starts after you've used the joint a lot, for example, if you've been gardening or if you just walked up a flight of stairs. Some people feel soreness first thing in the morning. As your joints become painful, they may also swell up. Swelling occurs due to increased synovial fluid in the joint. Synovial fluid is normal and can act as a cushion in a normal joint. In arthritis, you may have too much synovial fluid or have joint inflammation. The swelling can be painful and restrict your movement. Osteoarthritis is a type of arthritis that usually affects larger, weight-bearing joints, such as hips, knees and lower back. At first, only one joint may be affected. Arthritic joints from osteoarthritis feel sore and stiff, especially if you haven't used them for a while. Rheumatoid arthritis also causes pain and swelling in the joints. Usually the small joints of the fingers and toes are affected first. The most common symptom is stiffness, and it takes a long time to get the joints moving, especially in the morning. The disease is symmetrical, meaning that if your left index finger is swollen and painful, you'll usually have the same symptoms in the right index finger. Rheumatoid arthritis can be systemic, meaning it can develop to the point that it affects the whole body. Other non-joint symptoms can include shortness of breath, fever, chest pain. Like rheumatoid arthritis, psoriatic arthritis is an autoimmune condition. That means instead of protecting your body from disease, the immune system turns against your body and attacks itself. In addition to painful, swollen joints, the condition can cause rashes, eye redness and pain, and changes to the nails. Some people can get swelling of the whole finger or toe, which doctors refer to as sausage-like. This may help distinguish this condition from other types of arthritis. Gout is a unique form of arthritis because it often attacks the large joint of the big toe. But it can also affect other joints, such as the ankle or knee. Gout flares are typically very intense pain in one joint, with redness and swelling. People can get gout flares in the same joint over and over, or in different joints. There are medicines you can take to relieve gout flares and prevent flares from happening in the future.